Hello and welcome to our United to Beat Malaria New Champion Orientation. If you're not familiar with our organization, United to Beat Malaria is an advocacy campaign of the United Nations Foundation dedicated to ending malaria worldwide. Throughout this session, we hope to give you some insight on the work that we do and then how you can effectively advocate and help us in this fight. First and foremost, I would recommend that you sign up for our action alerts. You can do this by texting CHAMPION to 30644. This is the best way that you can hear about new opportunities to get involved and all that's happening with our campaign. Our session today will begin with a short overview of our organization, United to Beat Malaria, and our partners that are on the front lines of the fight. We'll then turn it back around and discuss your role in this fight and what it means to be a champion. Next, we'll highlight some of the main events that occur throughout our calendar year. After that, we'll dive into one of the most important advocacy actions, meeting with your member of Congress. And finally, we'll show you how you can track your advocacy efforts so that you can be recognized for all of your help. And with that, let's get started. United to Beat Malaria, a global grassroots campaign of the UN Foundation, brings together a diverse set of partners, influencers, and supporters across the US and around the world to take urgent action to end malaria. For more than 15 years, United to Beat Malaria, which is previously known as Nothing But Nets, has helped protect more than 39 million of the world's most vulnerable people by providing bed nets and other life-saving tools, in addition to successfully advocating for increased U.S. leadership and funding for global malaria programs. Despite tremendous progress made, a child dies nearly every minute from this entirely preventable and treatable disease. We know that a challenge of this magnitude requires individual and collective global action. That's why United to Beat Malaria is rising to the challenge to equip and mobilize engaged global citizens and partners to raise awareness, funds, and voices to advocate for a malaria-free world. By coordinating closely with UN agencies, the RBM Partnership to End Malaria, the Bill and Melinda Gates Foundation, the private sector, and civil society, we channel and mobilize life-saving resources to communities on the front lines of the fight against malaria, prioritizing the most vulnerable and marginalized populations. We know that we need a holistic strategy to end malaria once and for all. That's why we advocate for a full spectrum of innovative tools and strategies, increased political will, and resources. As advocates, our primary focus is centered around raising congressional support for the President's Malaria Initiative and the Global Fund to fight AIDS, tuberculosis, and malaria. The President's Malaria Initiative, or PMI, is the largest U.S.-led bilateral program seeking to end malaria. Since 2006, PMI partner countries have driven a 26% decline in malaria case rates and a 43% decline in malaria death rates. Despite incredible progress over the last 2 decades, malaria still causes an estimated 241 million illnesses and 627,000 deaths worldwide. PMI support gives millions of people the ability to protect themselves and others from this preventable and treatable disease. PMI recently published its 2021 to 2026 strategy called End Malaria Faster, which prioritizes a holistic, community-centered approach to defeating malaria that aims to strengthen partnerships and response systems using lessons from COVID-19 and other humanitarian crises. PMI's overarching agenda for the next 5 years aims to reduce malaria cases by 40%, decrease deaths by 33% in partner countries, eliminate the disease entirely in 10 countries, save more than 4 million lives, and avert over 1 billion cases. The second program we advocate for is the Global Fund. The Global Fund was an initiative started in 2002 that sought to better fund programs related to AIDS, tuberculosis, and malaria in middle to lower income countries. Since 2003, the Global Fund has supported countries through individual grants and multi-country initiatives. The Global Fund provides 63% of all international financing for malaria programs. They've also invested more than $16.4 billion in malaria control programs as of June 2022. Since January of 2021, they have increased malaria grants by 23% on average. They are the largest external financer of malaria programs in the Americas with a cumulative investment of over $337 million. The Global Fund's 2023 to 2028 goal aims to maximize people-centered integrated systems for health to deliver impact, resilience, and sustainability, to maximize the engagement and leadership of most affected communities, to leave no one behind, and to maximize health equity, gender equality, and human rights, and mobilize increased resources. PMI and the Global Fund help actively prevent malaria in three main ways. First, they support the research, development, education, and procurement of indoor residual sprays that coat the walls and other surfaces of a home with a residual insecticide. For several months, the insecticide will kill mosquitoes and other insects that come into contact with these surfaces. Indoor residual spraying is a proven and highly effective method to control malaria that offers a community protection when at least 80% of houses in a targeted area are sprayed. Second, PMI and the Global Fund distribute insecticide-treated mosquito bed nets, otherwise known as ITNs, which have contributed to 2/3 of the reduction of malaria cases over the last 2 decades. Compared to previous iterations of bed nets, the current second-gen ITNs are treated with 2 different insecticides that can kill mosquitoes that are resistant to one of the 2 insecticides. Third, PMI and the Global Fund supports the expansion and strengthening of diagnostic testing to ensure that all patients with malaria are properly identified and receive quality-assured medicine in health facilities and at the community level. This approach ensures that not only confirmed malaria cases receive treatment for malaria, but also facilitates the detection and appropriate treatment of other causes of fever. Another part of this is the research and development of immunizations. In 2021, World Health Organization approved the use of the RTS-S malaria vaccine through routine immunization programs in Ghana, Kenya, and Malawi. These pilot programs demonstrated a 30% reduction in severe malaria when introduced in areas with wide use of insecticide-treated nets and good access to malaria diagnosis and treatment. It's imperative for our champions to meet with their members of Congress to reinforce the importance of global health programs such as the Global Fund and PMI in strengthening health systems worldwide and protecting decades of progress towards malaria eradication. Now that you know a little bit about us, let's talk about you. As a champion of United to Beat Malaria, you have the ability to raise your voice in a number of ways. Dr. Obed, originally from Rwanda, now living in California, helped to fundraise almost $25,000 for our cause. Longtime champions Jesse and Ashley from Washington State have helped us lead advocacy webinars and contributed greatly to fundraising efforts. Jeff, who hasn't missed a summit yet, is a leader for malaria advocacy in his own community in Wyoming. And finally, Winter, a champion and scientist, was invited to present at an international conference on malaria research and has helped contribute to the malaria vaccine research as well. All of our champions come from a diverse range of backgrounds, but all are passionate about ending malaria. We're always looking for opportunities to showcase our champions and promote their personal and professional development. With that, let's unpack what it means to be a champion. As a United to Beat Malaria champion, you are the voice of the fight against malaria in your community. Our champions' advocacy efforts lead to real change. As U.S. residents, champions can play an important role in helping to secure strong funding from the U.S. government for malaria prevention programs by meeting with their members of Congress, making calls, writing letters to the editor, posting on social media, or signing petitions. All of these actions help persuade members of Congress to support life-saving malaria programs, including PMI and the Global Fund. Next, we'll discuss some important advocacy events for our champions throughout the year. Our champions come together across 4 main moments of each calendar year to advocate for the end of malaria. Our first and largest moment is our Leadership Summit, which this year will take place from March 26th to the 28th in Washington, D.C. This is the first year since 2020 that we're able to hold in-person meetings again, and we could not be more excited. During Summit, our corporate partners, grassroots champions, members of Congress and their staffers, and even some celebrities come together to discuss the importance of ending malaria and the role that the U.S. government can play in helping achieve that goal. Next, we have World Malaria Day. This year, we're approaching World Malaria Day differently, and starting on April 24th, we'll be hosting Days of Action, where each day we'll focus our efforts on a different form of advocacy action. These actions can range from signing digital petitions, posting on social media, and calling members of Congress. After that, we observe World Mosquito Day during the summer, in which we ask champions to engage on social media as well as prepare to meet virtually with their members of Congress in support of PMI and the Global Fund. These virtual advocacy meetings are a great way to get direct advocacy experience in preparation for future in-person meetings. As we close out the year, we look towards Veterans Day on November 11th. This is a great moment of the year to recognize the threat that malaria poses to servicemen and women abroad in malaria-endemic countries and the role that we can play in helping end malaria worldwide and keeping them safe. On this day, champions can engage in digital advocacy by sharing the campaign's social media content. This all may sound like a lot, but don't worry because our team will be a great resource for you and coach you during each step towards success. For our US-based champions, you have the opportunity to meet directly with your member of Congress. This might sound daunting, but again, we'll be with you every step of the way. You'll be able to work with champions from your state and your local communities and be able to practice talking points that we'll provide you with. In general, a meeting with your member of Congress will go like this. Once your meeting begins, the office will ask you and your group why you choose to advocate with United to Beat Malaria. This is where you introduce yourself, share where you're from so that they know you are one of their constituents. Next, tell your story. It's really important to be able to make a personal connection and say why it's so important to you that we support malaria eradication efforts. After that, talk about the issue and why these programs are so important and the impacts that they can make worldwide. After this, the big one is to make the ask. Now, the ask in our meetings with members of Congress will vary year to year based on the goals of both PMI and the Global Fund. Once again, our team will provide training around the specific asks in preparation for these meetings, as well as provide additional training on these programs and their impact. So at no point are you expected to be a policy or global health expert. Lastly, of course, say thank you. Never forget to take a picture and provide the leave behind materials so that we can track your engagement and maintain these relationships with these members of Congress and Senate offices moving forward. I also want to now highlight our advocacy webinars. They occur every other Monday at 6 p.m. Eastern Standard Time over Zoom, and I want to emphasize how great of a resource they are. They touch all bases in malaria education and advocacy, and we usually invite a diverse perspective that range from policy experts to community healthcare workers, and even members of our own staff who work in communications, advocacy, or development. These are a great way to learn more about the fight against malaria and to hear from interesting and diverse speakers. You can sign up for these webinars through our Zoom registration link. Info on these upcoming webinars is always in our advocacy text and emails, so just remember to text CHAMPION to 30644 to make sure that you have the up-to-date information and stay involved. As a United to Beat Malaria champion, you can track your progress in developing your advocacy skills by reporting with our STAR system, which stands for Self-Tracking Action Report. This is a great way to also submit verification of your advocacy tasks to our team so that we can elevate and put a spotlight on our champions who are consistently engaging and meeting with their members of Congress. As a champion, it's very important to be on top of submitting to STARS so that you can get full credit for all of the advocacy work that you put in throughout the year. You may ask, how does this advocacy add up? Well, as you can see, each action type has a point value assigned to it. Our largest moment in the year, Leadership Summit, is worth 40 points. In-district meetings, such as meeting with your member of Congress, is worth 20 points. Then we have our advocacy webinars, which are bi-weekly on Monday evenings. Other ways to earn points include fundraisers or in-person events, publishing a letter to the editor in your local or regional publication, calling your members of Congress, and also the various different social media actions you can take across Facebook, Instagram, Twitter, and email petitions. Next, we'll walk you through on how you can report your advocacy efforts through our STAR system. Again, this is how we track engagement across our champions and how we choose which champions to elevate and promote as advocates for our campaign's events throughout the year. You can access the Star Tracker via two methods. First is by scanning our QR code at the bottom right, which will also be posted at all bi-weekly webinars. Second is to access it directly at our website, beatmalaria.org. We encourage you to explore this site as it has a bunch of great information about the work that we do and the important efforts in eradicating malaria. Going back to the Star Tracker, once you're on our site, you're going to want to click on the tab at the top titled Advocacy. You'll then be brought to a page where you'll scroll down until you see the Self-Tracking Action Report, and there will be a button that'll be titled Submit. Once you press that, it'll bring you to a form where you fill out your first name, your last name, and then your email. Next, you put down the date of when you completed your activity, such as when you met with a member of Congress, when you had a letter to the editor published, or when you engaged with us on social media, or anything else like that. After that, you'll select the type of action that you completed. For actions under advocacy, we have attending Leadership Summit, attending an in-district meeting, or attending an advocacy webinar. Under communications actions, we have publishing a letter to the editor, calls to members of Congress, and social media actions through Facebook, Instagram, Twitter, or email petition. Last, under fundraising action, we just have fundraising events. Once you select your action, we just need a little bit of proof so that we can track this engagement, like attaching a screenshot if you attended an advocacy webinar, for example, or if you're at an in-district meeting, providing the leave behind materials or a screenshot of the Zoom meeting, or if it's in person, a photo with the office. After that, hit submit, and then your advocacy action will automatically be logged into our system and you'll be all set. We are at the end of our new champion training. We hope it gave you some good insight into the work that we do and how you can get involved from home in your community to advocate for the end of malaria and help get crucial funding from the U.S. government to on-the-ground programs. Some next steps is to follow us on social media platforms like Facebook, Twitter, and Instagram. This is a great way to stay updated as we post about our Leadership Summit and our bi-weekly webinars. We'll also host the occasional giveaway as well as live conversations with some of our devoted champions. So we encourage you to stay involved and engaged in the conversation to end malaria and make sure to tag us on social media as well. Another next step is to once again text the word champion to 30644 so you can stay up to date and receive our action text alerts. Thank you so much for your time and thank you for your interest in helping us end malaria. This is a fight that takes cooperation and teamwork, and we really appreciate you being a part of it.